Greetings, loved ones. Today we are continuing to talk about how to heal from trauma and PTSD. Help us get these messages out. Please subscribe to our YouTube channel. Drop us a message. Tell us what you think. Follow us on Facebook, Instagram, and Twitter. Hit the like button. Hit the notification bell. And please share these messages with others. You could save a life. As many as 1 in 11 adults in the United States will be diagnosed with post-traumatic stress disorder, PTSD. PTSD can develop following a single traumatic event, such as a natural disaster or a sexual assault, or long-term repeated traumas such as childhood abuse. And many people have experienced traumatic events in their lifetimes, but not everyone will experience traumas. Who experience traumas will develop PTSD. Many people try to avoid thinking about their trauma, but research has shown that denial or trying to repress trauma leads to further distress. If you are struggling to psychologically recover following trauma, or if you are concerned that you have developed PTSD, I want you to know there is hope. Several types of therapy have been shown to be effective for helping people recover from trauma. Today we're continuing yesterday's list of therapies available with the more controversial types of therapy. So the ones we're talking about today are really controversial. So the first one is prolonged exposure therapy. In prolonged exposure therapy, or PE, a PTSD patient is asked to continually retell the story of the traumatic event, reliving it and describing it aloud as they are imagining it, using present tense and vivid details. The retelling is recorded and the patient is asked to listen to the recording at home between therapy sessions in order to get further exposed to the traumatic story. I don't like this one, but we're going to tell you about it anyways. A typical course of PE therapy lasts between 8 and 15 sessions. The theory behind PE is that recounting the traumatic story enough will make it lose its traumatic influence and make it feel like a regular memory. There have been a number of studies done evaluating the effectiveness of PE. For example, one study from 2012 found that 5 to 10 years after receiving PE, only 14% of rape victims still met the criteria for a PTSD diagnosis. However, the effectiveness and use of PE is controversial, and some therapists have reported concerns about using it. One criticism is that many patients stop doing PE before their course is over because they find it too distressing. As many as half of patients drop out of PE therapy. Patients who also have a diagnosis of depression are 9 times more likely to drop out of PT than others, and about half of the people with PTSD also have depression. And one study even found that 10% of patients got worse. Another criticism is that the studies that assess the effectiveness of PE are poorly designed. Dr. Bessel van der Kolk, director of Boston's renowned trauma center, has criticized PE. He says that trauma does not need to be relived in order to be healed, and in fact, the parts of the brain that went offline during a traumatic experience also go offline when people re-experience their trauma. Therefore, PE might distress PTSD patients without helping their brains rewire in order to properly process the trauma. Okay, another form of help, which I think we rely on this one too much and need to be working on the ones we discussed yesterday more. And it's pharmacotherapy. That means using drugs as treatment. Most people who have PTSD also have another mental disorder such as depression. And this makes it hard to do research on which medications are effective for PTSD because different PTSD patients might have different co-occurring mental disorders. There are only 2 medications that are approved by the Food and Drug Administration for treating PTSD, Zoloft and Paxil. Both of them are a type of antidepressant called selective serotonin reuptake inhibitors. SSRI. SSRIs have been shown to have only small benefits for treating PTSD. Some other types of medication are prescribed off-label for PTSD, meaning doctors prescribe them even though they're not approved by the FDA for treating PTSD. Some examples of medications used off-label for PTSD are antipsychotic drugs and benzodiazepines, a type of anti-anxiety medication. The risk of these drugs seems to outweigh the benefits since there is no solid evidence that antipsychotics help and they can have serious side effects. Also, research suggests that benzodiazepines might actually make things worse for PTSD patients. Recently, researchers have been investigating whether drugs like MDMA, ecstasy, or psilocybin, magic mushrooms could be treatments for PTSD. Remember, we're talking about controversial treatments here. The drugs are being tested as a way to assist PTSD patients during therapy. The idea is that the drugs will help reduce the fear reactions common in PTSD in order for the patients to be able to talk about their experiences without being overwhelmed with fear. These drugs should not be taken outside of a clinical setting as a do-it-yourself treatment for PTSD since the risks and benefits are not yet known. Clinical studies testing the effects of these drugs are currently underway. So what's the bottom line here? The road to recovery from trauma and PTSD, it's not a simple one. The mental and social effects of trauma can stay with a person for years, and one specific therapy might not work for everyone. Luckily, there are several types of effective therapies that you can choose from and try. And remember, the question is not if you will encounter a victim of trauma or violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You could prevent a suicide. You are called. We are all called to be champions for justice, and those who suffer violence and trauma, they need to know that those who love them and those who don't even know them will reach out and give them the help they need before it's too late. If you're a victim of violence or you're suffering trauma, I want you to listen to me. I want you to know all the lies you've been told, all of the things that have happened to you that have destroyed your self-esteem. I want you to know what the truth is. And the truth is that you are valued, you are loved, you are intelligent, and yes, you are worthy. God does not want you to suffer trauma and violence. He wants you to heal and to live free from violence in peace and tranquility. There is a way out. It's not your fault. You are not a victim. Abuse is not love. And most of all, you are not alone. If you're a victim of violence or trauma, reach out to someone today. If you find yourself in a dangerous situation, dial 911 for help. If you know of someone who's suffering trauma, please help them out. And if you know of someone who's suffering violence, report it to the authorities. In our next episode, we're going to talk about the stages of recovery after trauma. Until then, God bless you.